and my very noisy birds. Um, they're loud and they're always this loud unless it's like the lights are off or I covered them, and I don't really feel like covering them right now because it's daytime. But yeah, hi, hello, welcome or welcome back to my channel. I go by Eternal Honesty on this channel, and this is really going to be, wow, they're really loud. Maybe I should cover them. I actually think I'm gonna cover them. Give me a second, guys. Okay, guys, you're gonna go night night. It's gonna be dark for you guys right now because y'all being real loud. But sorry about that. I'm trying to get them to be like a bit calmer, not be screaming, screeching in the background. But as the title for this live says, I will be doing like a little Q&A. I'm going to start off with like just saying most frequently asked questions I get about nursing school that I've seen. I've gotten a lot of people on TikTok asking me, hold up, let me fix my camera just a little bit. Yeah, I get a lot of people, especially on TikTok, 'cause that's where I post a lot of my nursing school content, like DMing me or asking me under my like videos and stuff, a lot of questions, and some of them are very much the same or within the same general like theme. So I'm gonna like answer those, say what those questions I get asked are. If you guys have any questions, please feel free to drop them in the chat and I'll answer them as well. And also like the other part says like, help me to pay my tuition. Like with you guys watching my videos, watching the ads on my videos, I get the ad revenue. So yeah. Yeah, any questions related to nursing school? Mainly, because that's the whole point. So I guess one of the most common question I get asked is like about like prerequisites, right? Like what prereqs you need to take in order to get into nursing school. Um Oh, that's an amazing song, and I cannot sing to save my life, so I will not be singing. Uh, yeah. How long have I been growing my locks? I don't call them dreads. I don't like the way that sounds. But locks. I've had my locks for over a year. These are not all my hair. I have like fake hair wrapped around my hair, but the longest ones of my locks are like about collarbone in the very back, and they're kind of layered. So this is about the length of most of my locks, like if I were to have my like natural hair out. So yeah, thank you. But going back to the nursing school stuff, one of the most common questions I do get asked is what prereqs do you need for nursing school? Like, and this is such a good question, and it's one that's hard to answer because every nursing school will have their own prereqs. Like, so for instance, the most common classes that you're going to need from almost every single nursing school is going to be anatomy and physiology. So A&P, both 1 and 2. And then you're going to need to take stats. You're going to need to take psychology. Usually some schools like you to take lifespan psychology. Some school just intro to psych is fine. Be very mindful about that. And then the other class you need to take like general chemistry, right? Those are like the four. Oh, and microbiology with the lab. So those are going to be like the 5 classes that every single nursing school is probably going to require you to have taken, especially if you're going for a BSN, because there's LPN, ADN, BSN. Those all vary. But if you're going for a BSN, those are going to be the main classes that you need to take. Some other schools might require you to take a bioethics class. Some school I've heard you need to take nutrition. I've also seen it. So there's are particular schools that require other things. One school I was looking at required me to take like anthropology or sociology, and I was like, what the heck? Are you kidding me? So that's the school I automatically ditched because that's like two classes I've never taken that I would have had to go and retake. And I wanted to minimize how many prereqs I needed that I did not get from my undergraduate degree because I did an ABSN program. So that's what you need to like be very mindful of. So yes, so that's why when I say doing the prereqs one, when people ask that one, it's such a good question, but it's going to vary based off of the schools you want to apply. So my tip I always tell people is look at all the different schools that you want to apply to and see what are their prereqs and which ones you have already or which ones you would need. And if you see like, oh, you're going to require maybe a lot of classes that you haven't taken already, maybe that's not a school that you might really want to like look into because now you have to go take maybe 2-3 more classes and nobody wants to do that. I saw a question, can a nurse become a doctor? Who does she need to go back to school? A nurse can become a doctor. There are people who do this, but you would obviously need to take the prereqs that you need for med school that you haven't already taken, and also take your MCAT. That's basically it. So like I know for med school I need like biochemistry. I did not take biochemistry. So if I became a nurse and I want to go to med school now, I would need to take biochemistry. I only took one organic chemistry class, organic chemistry, OChem 1. So I would need to take organic chemistry 2 because you need both for med school. So that's really the only thing. Like you would have to take the classes that you would need for med school before. Like I'm doing an accelerated BSN, so that means it's a lot faster and I would have had to already have a college degree. With same thing with if you wanted to do this type of degree, you would just need to make sure you have all your prereqs. So I know someone who has a dance degree who's in my ABSN program. I'm pretty sure he had to take a lot of prereqs because his degree didn't cover it. Versus with me, I went to undergrad and got a degree in marine biology, so it's still a bio course. I have a lot of the prereqs that I needed. There were only three prereqs, A&P 1 and 2 with the lab and microbio that I didn't have for my degree. I did a marine microbio, but they were not accepting that, unfortunately. So I had to go back and take those prereqs because I didn't have them from my first degree. But I had like general chemistry, I had stats, I had psychology from my first degree, so I didn't have to worry about those classes. So that's what I mean. Yes, I love marine bio, even though I don't work in the field. It's still a huge part. I love the environment like so much. So yeah, I taught science and I taught use like my marine bio, and I did environmental education as well, where I talked a lot about the ocean, animals in the ocean ecosystems. I also did help to create an ocean literacy curriculum while I was doing environmental ed, which honestly that made me happy, made my marine bio heart so happy. So yeah. How am I? I am great, thank you. Chemistry 1 and 2, and in some cases organic. Yeah, definitely. If for the one person who asked me about like switching from nurse to be a doctor, you're definitely gonna need organic chemistry. Thanks. But yeah, happy birthday, Aziz. Yeah, like, but I think the person was like, if you're already like working as a nurse and you want to go back to become a doctor, is that something that's possible? I actually have a younger sister who's currently in undergrad, and she's like toying with the idea of becoming a nurse and then going back to being a doctor. Some people do that because you can work as a nurse, you could work in the field and make money and then pursue med school after the fact. Because a lot of people, if you go straight from undergrad to med school, you're not really working a job that's providing you with substantial amount of money. Versus as a nurse, you can make a lot of money while you're going back for maybe your last couple prereqs. You look so young to be so successful. Thank you. I'm 27. I'm gonna be 28 in less than a month because my birthday's in the beginning of the year in January. But yeah. Another question I get asked a lot is like, I guess like, do I recommend like an ABSN program? And as much as I'm doing an ABSN, for me, the biggest reason why I chose to do the ABSN is for the reason like time constraint. Like I already have 2 degrees, and like I just said, I'm 27. I did not want to go do a 4 year bachelor's for nursing when I can do a 1 year because I already have a degree, and it's gonna get me out of school quicker and work faster. If you're someone like like you cannot handle a lot of pressure, or school is very overwhelming to you in general, I don't recommend an accelerated BSN because it is very fast paced. My first semester just ended. I did very well, but that's also from the fact that like I love learning. One, I have 2 degrees already. So I know my learning style very well. And because of that fact, studying is not that it's easier, but like I know how to study for me to retain that information. If you're younger, you might not really know what's your best study style yet. So I would recommend going the traditional route. Also, you like I said, the one main point, you need to have had a degree already to do an ABSN. If you do not have a degree, you can't do an ABSN. Give me 1 second. Let me see who's at the door.
Hello, how you doing now?
I'm good.
My mail.
Oh, okay.
Mom,
Yeah. Go ahead and second. Like I was like doing in the middle. Something. Where did I move all the mail actually? Because I had all the mail
I
in the
think she
chair.
said her nephew, she had told him where they were. I'll
Oh.
show you what.
Okay, this.
And how come you didn't go to Jamaica?
I wanted to work and make money.
You wanted to work than to go enjoy yourself?
Well, I'm in nursing school. Nursing school is expensive. I can't work a lot during the semester, so this is like the one time I can really work.
Oh, okay.
Yeah.
I get it.
Yeah, so this was like, I'm just gonna stay home with some money.
I get it. Because she said she's the only one that didn't. I was like, why?
Yeah.
Okay.
It's like, I would have gone if it wasn't for that.
Yeah. I
These are
understand.
all for you.
I understand. Alright, so there's this card that I'm looking for because my card got compromised.
Oh, I'm
And,
sorry for that.
Yeah, and they claim they sent it, so let me see if it's here.
She doesn't have any mail over here for you. Because I know we normally keep it back here, but there's none. And that's what's came more recently.
Mental motor vehicle. Why are they saying? Oh, this is all right.
Yeah,
It's not
that's
there.
it. I'm
All right, I'll
sorry.
call them. That's okay, honey. Thank you.
You're welcome. Okay. Oh, so sorry, guys. Yeah, it's a lot. Yeah, by the time I'm done with nursing school, it'll be my 3rd degree. And honestly, I think after this, I'm pretty done. Like, I don't know. Everyone keeps like, oh, I see you going for MP, CRNA, like becoming a doctor. And I get it. Like, I don't want to toot my own horn, but like when I go after something, I go after something and I go after like full force. I get like such tunnel vision when I'm in school. Like, I need to get A's. Like, I got my GPA after my first semester is a 3.94. I got 1 A minus and then 4 A's, which is why I don't have a 4.0. And I was very annoyed about that A minus, but we're just gonna let that slide. And that's with working 2 jobs. And my friends are just like, that's so impressive. Like, how can you even like? It's just so impressive. And I'm just like, for me, that's just like, I don't know. I just feel like I'm not like super impressed by that because I'm like, I should have gotten a 4.0. But at the same time, I do give myself the grace and the acknowledge that, It is a lot of work, and but I know it's very much doable. And that's one of the thing is I don't like I when I was going into nursing school, I went in with the mindset like other people have done ABSN programs, have graduated. There's no reason why you cannot succeed and you cannot pass. So that's like my mindset with it. Like I don't go into thinking, oh, it's gonna be so hard. Because once you do that, you're already defeating yourself in your mind and in your head. I have not done any internships, but with how the AVSN programs are run, you usually are doing your clinicals right off the bat, so you don't really have time. And I also do work 2 part-time jobs, so my schedule is booked like every single day of the week, except for like one day. I had something to do. I'm either at work, clinical, or in class. Like this past semester, I had my in all Thursdays, I had my Thursdays off. But other than that, like I literally had something to do every other day. I work on the weekends. During the week, I'm either clinicals or in school or sim lab. But yeah, do you guys have any other questions about like nursing school, like the process, like the classes, anything? Let me know. Those are, like I said, those are the two common ones I do get. I recently had someone asking me about how to go from like a different country, if they were in a different country trying to come here to do their BSN, like how would that work? But I don't really know too much about that, the legalities of that, because I live in the US, and I know about like the process of like if you're already in the US, how to do that. Because there are bridge programs. Let's say you are uh ADN and you want to become a BSN, right? Because ADNs are still registered nurse. If you want to become a BSN, like there are bridge programs, right? That just helps you take the last few classes that you need for your BSN. And I recently found out, which was news to me, and I don't know why it just doesn't make sense, but I think it's kind of not the smartest thing, but whatever. For the NCLEX, which are the boards that people who are pursuing nursing take, the NCLEX for those pursuing an ADN and a BSN is the exact same boards, which I thought was interesting because a BSN is like a higher level of like material and things that you learn compared to an ADN. So I thought they would have a different NCLEX, but now it makes a lot of sense to me why a lot of people who I know who have taken the boards and passed, the NCLEX and passed, who are pursuing BSN degrees, thinks it's not that bad and it's can be easier than their nursing school exam because people are taking an ADN who are a lower level are also taking it. So like you kind of have to make it in a sense it's gonna be easier for the BSN maybe than for the ADN. For the ADN, it might be like just on par with like their nursing school exam and what they've been learning. But if you're taking a bit higher level, it's going to probably seem a little bit easier. And I'm like, oh, that makes a lot of sense because almost every single person, actually no, just about everyone who I know who's a nurse, they are BSN, right? I think my aunt is the one person who did ADN and then bridged to BSN. When they took the NCLEX, they passed on the first try, and they were like that was a lot easier than their nursing school exam. So I'm just like that kind of gives me hope that when I'm done and take my NCLEX, that it won't be too bad. Am I still gonna study and stress myself out maybe a little bit over it? Of course, because we don't want to be like, oh, it's gonna be easy and going unprepared. I don't think it's going to be easy, but I don't think that it's going to be impossible. It's very much doable, right? You just have to make sure you're prepared for it. So that's how I'm going to look at the NCLEX at the end of the day. But yeah, so that's that. And again, the first part of this video did mention like help me pay my tuition. Guys, I need to come up with the money for my tuition. Like the remaining, like I took out a loan, but I still have like a little bit left over that I'm gonna have to pay. So the biggest way that you guys can help me with paying my tuition is like watching my videos, watching the ads on my videos. Am I prepared for the work hours? That's such a good question. So if you're a nurse, the traditional nurse right, that most people think of are the nurses working in a hospital, which we consider like an inpatient setting. They work 3 shifts, 12 hours. I am very much prepared for that. I work in a group home on the weekend, and sometimes I do 16-hour shift. Like this past Saturday, I did 16 hours, 7 a.m. to 11 p.m. Is the work that I'm doing during that time period the same as a nurse? No. But like the fact that I'm in a job actively, brain is on, you have to be engaged for 16 hours. Yes. So I definitely think I am prepared. My school does a thing at the last semester where you have to follow a nurse around, and you're kind of on your own after like the first couple of shifts, where you're working a full 12-hour shift. As a, like, we're not nurses, we're like still nursing students, but like you're basically being a nurse to like a patient, right? So hi there. Hi. Yeah, so like I get to see what it's really like. And the way my school does it, like you get to pick like what specialty you have an interest in actually working in, if they offer it. So like my school, I know they say like they do oncology, they do like OR. So I personally would love to go into like PACU. So like that's when people come out of anesthesia, like, they're recovering. That's where they go first. They go to the PACU unit. That's where I would love to work. Or in the OR. So like in the operating room with the surgeons, like caring for the patient. So those are the specialties I want to do personally. So I'm going to try and see if like my last semester I can get placed on a unit like that to really see and get exposure to it. But I do think I am prepared for the 312s. I want to do the 312s because honestly, that's one of the things that like attracted me to nursing, because I'm like 3 shifts for the week and then I have 4 days off. Sign me up. Sign me up. Like, I do not mind working long hours. I've had multiple jobs where I've worked long work hours. Like, I worked in a lab where even though my shifts are 8-hour shifts, I would always be doing like overtime. So I have worked like 12 hours. Yes, I've worked like 4 extra hours. I'll come in early and I'll still end up leaving late. So the 12-hour shifts is not something that's like concerning to me. You could also work outpatient where you work at like a clinic and work more regular, like 9 to 5 hours, like 5 days a week. I actually am in a serious relationship, but my partner, he's also in healthcare, so he gets it, which is crazy. I remember that's a question I feel like should be talked about a bit more. Like, if people think like you cannot make time for a relationship when you're in nursing school, especially the way my program is set up, but I honestly can say like we made it work. It's not going to be for people who have to see their partner like every single day or like every couple days. Like, we saw each other on average like every week, like at least once a week. Sometimes we even saw each other twice a week, depending on the week. But we are both students and we both work part-time jobs on top of being in school, but yet we still found ways to like hang out and like see each other. Sometimes it is us going out to eat, like, or hanging out at either person's house and studying. We did do like a lot of study dates where like we both have schoolwork, so we're both just like in each other's presence getting work done, and then like we'll watch a movie. Like, we'll get work done for a little while, we'll watch a movie, and just like spend time with each other. But it's just like you have to be very intentional when it comes to your relationship, and also be understanding that your partner is going to be at sometimes busy and cannot make time. But I will say, for my relationship, we definitely made time for each other, even though we had things to do, like, and I thought it was gonna be really hard, but I'm like, nope. I'm like, no, I want to see you. We're gonna spend time. So a lot of times it'll be like on the weekends after my shift, I'll go over, or we'll have something that we're doing. Yeah, I think nurses save money because that's actually not true. I know a lot of nurses who be having fun, like especially if you're doing your 312s, like there's a way that you can do your shift where you can have like a whole week off without taking any PTO as a nurse. And I have many friends who have done this. It's so if I decide to work like Monday, Tuesday, Wednesday this week, right? But then the following week, I say I'm gonna do like Friday, Saturday, Sunday, all of those days, like in between, I have off. That's like a week off right there. And a lot of my friends who are nurses, if they have a stretch like that, they'll book a trip. Like they'll take a little vacation, whether it's out the country, out the state, whichever, or they can just spend time at home. But if I have like a whole week off and I have the funds to book a trip, I will be booking a trip too. So yeah, like you will still have time for fun. Like maybe that first day off, like you're just catching up on sleep because like, you did just do it 12, like 312s in a row. And that's another thing. Like some people, they love to stack their 312s and just bang them out, like do the 3 in a row. I have one friend, like she swears by just doing her 3 in a row. Versus some people, they don't like that. They like to have at least a day or two, like maybe like 2 on, 1 off, and then 1 on, or whichever way. But yeah, there's definitely time for fun even as a nurse. You just need to know how to make your schedule to accommodate the things you want to do. And I'm looking forward to that. That's one of the things I'm looking forward to as a nurse, is doing just my 312s, and being out afterwards. But yeah. What else? What else in nursing school? I am planning to make I need to make an actual sit down video for like to wrap up my first semester of nursing school, and also like talking about next semester. But I guess I'll talk about next semester on here anyways. So next semester I have 5 classes again. These are going to be like the heavy hitting course. These are going to be like the really like core nursing classes. So I have that. I also have 3 clinicals. I'm like, honestly, I'm like genuinely like, oh my gosh, 3 clinicals is going to be rough, but we got this. We can do it. And yeah, like that's basically for next semester. So my 3 classes are med surg, so medical surgical. So these are the people who come out of surgery. And there's a lot of disease processes that you see in med surg. So I think med surg is typically the unit a lot of people think of when they think, oh, like I have a family member who's like, admitted to the hospital for like complications, so like post-surgical complications, right? They're going to probably be on a med surg unit. Unless it's really, really like critical, then they will be in like the ICU, intensive care unit. But if they're not in the ICU, they're probably going to be on a med surg floor. And then I have OB, so mother baby, right? What happens during pregnancy. And then I have pediatrics, so from baby to all the way up to adulthood, which is going to be like so much information, because so much happens from the time a child is born to the time you become an adult. All the milestones, all the changes are happening, and that you have to know what's normal, like, right? What are the normal developmental milestones? So that's going to be interesting. So that's 3. I have bioethics, so an ethics class. That's, I think, is going to be the easiest class because it's just bioethics. And then the last one, is Pathopharm 2. So pathophysiology and pharmacology 2. I did Pathopharm. I actually genuinely enjoyed. It's such an interesting class. I love learning physiology. It just, I don't know, like disease processes, understanding what's happening in the body because like something's changing, interests me. It always has, which is why when I was younger, I wanted to be a veterinarian because I want to care more about like animals. But like veterinarians and vet science, like anything with the vet field, does not get paid as much as humans. So unfortunately, it is a bit, I am following the money. But at the same time, if I'm gonna go into like thousands of dollars of debt, I want to come out making a job that where I can pay off that debt. If I did veterinary science, the money I'll be spending versus the money I'll be making does not match up at all. So I chose human medicine, unfortunately. But fortunate for them that I am still passionate about medicine and about caring and being empathetic. So yay, yay. Like I've always just been very an empathetic person towards animals, towards humans. A bit more towards animals though. But we can make it work. um yeah, so those are the classes I'm taking next semester. That my 3 clinicals are going to be for OB, so mother baby, for pediatrics, and then for med surge, which I technically have done a med surge clinical because my fundamental clinical was on a med surge unit. So I'm going to have a lot of experience on a med surge floor coming out of nursing school, just because like I did it for what, like about like 6 weeks this past semester, and I'm going to be doing it for about like I believe like 9 weeks next semester. So a lot of experience on med surge. I did not mind med surge, as a lot of people talk down about med surge units and that like they don't would never want to work med surge. I honestly, like, after being on that unit, I'm kind of opening my mind to like, hey, if I can't find a job in the specialty I really want, I would have no problem working on a med surge unit as long as that unit can guarantee me safe nurse to patient ratio. That's why I think it's a big thing when it comes to med surge, is having those good ratios. So I shouldn't be having like 10 patients as one nurse. Like that's too much. Like, because the hospital I was at, the normal ratio I believe was 1 to 5. I think that's doable. I think that's good. But like once you start seeing like 1 to 8, 1 person to 8 patient, 1 nurse to 8 patient, like no, that's a lot. That's a lot. So that would be like something, if I were to like pursue med surg, I would definitely would want to ask in my interview, like how is like the staff thing ratios looking like. But yeah. What else? What else? Like, so that's like next semester. I'm excited for labor and delivery, like mother baby. Um, I don't know if it's gonna be an L&D or a mother baby, which are different things. I did not realize they were different things until like I asked my clinical instructor last semester, actually, because she's big, she loves OB, she's done OB for many years. So the difference is labor and delivery is exactly what it's saying. People who are going into labor, right? Or who are waiting on going into labor to deliver their baby. Mother baby is for after you have given birth. So like postpartum, right? So like they're still on the floor, they're still in the hospital, but the baby has already been born. So that's what, yeah. Say hey baby mom, hey baby mama. But yeah, so that's what it is. And I don't know which one. I feel like I would love to see labor and delivery. Like, I don't know, I would love to see like people going into labor, a baby being delivered. I feel like that would be pretty cool versus like mother baby. Like, okay, the baby's here, babies are cute, but like I kind of want to see like labor like happening. So I don't know what kind of floor I would be on yet. I just know I will be doing an OB rotation. They have not like told us yet specifically what type of floor. Same thing for same thing for peds. I just know it's peds. Peds have a lot. Like, I think people don't realize like there's a lot of subspecialties when you think nursing. So you can have pediatrics, but you have pediatrics ICU, pediatrics ER, like pediatrics oncology, like so it's like there can be different subunits under that one, under just like kids, right? So I don't know what type of units it will be for peds either. Yeah, it could also be like a peds like surgical unit, like, like, so it can be so many things. I don't know. Med surge is pretty much med surge. Like, you can have people who are more like stable, or you can have people that are a little bit more like kind of like fresh out of surgery. Like I remember when I was on med-surg last semester, we saw like some people who literally came from the ICU as my baby. I don't got none. But yeah, like just came out from the ICU, and then there are people who have been there for a while. But yeah, or people who came from like ER and then placed to med surg. So like that's what I'm saying. Like it really varies on the hospital and the unit. But yeah, that's it. Like next semester, I think I am trying to just enjoy my break, because I know when I go back, I just have to hit the ground running. Like first semester, because we did not know what to expect. It was just like, okay, like, you know, going in very not knowing anything at all. Things I would tell myself now looking back, just being very organized, which I would say that is something I did do, but I would emphasize it, having an organization system that's going to keep you on track of assignments, things that's happening both personal life and school life, right? Raphael, hi, Raphael. Like, but yeah, like just having a good system in place where everything is organized. I like the Excel sheet I had. I am good at remembering dates though, so I usually Raphael, my baby mama. Guys, say hi to Raphael, my baby mama. Love that. Uh like my hairdressers. I don't know. I get compliments on my hands all the time, but thank you. uh yeah, so just having a good system in place, keeping everything organized, staying on top of your assignments and studying, like really important. If you can get ahead before the semester starts, like, because with one of my class, the professor actually released and opened our assignments prior to the start of class. So I did get started on some of those assignments before the semester started, which that helped me once the semester started. So I would say that really helped. That really helps. So if you can do something like that, getting ahead of your assignments in any of your classes, all of your classes, but just like getting ahead helps you. Because the way I look at it, if I did all the assignments already, when it comes time for exams, I don't have to worry about like, oh, these assignments are due. Like I remember like I did that with one of my classes. I did like almost all of like what we call lessons at towards the beginning. Once I realized, I'm like, you know what? Let me do this. I remember having a conversation with a friend. She's like, oh, I heard someone who took the program, they said like just do all the lessons in advance and it really helped them. And I'm like, you know what? I'm gonna do that. So I sacrificed like one day and I did that. I did all of them. And when I tell you, it really helped me, because when like throughout the semester, when my friends like, oh yeah, I have to do the lessons, I can't forget to. I'm like, I already did all of them. So like that just freed up more time to study, right? To do other things, like instead of having to worry about like this assignment. And I did those assignments when I was at work, guys. Like I literally did so many of those assignments at work one day. So using your time wisely. And the other thing is, I've said it before, get creative with how you study. Like, I would study on the train, I would study on the bus, I would study when I'm driving to visit my friends. Uh, but I will like study when I'm in the car, like driving places. Like when I would drive my younger sister back to her college campus, I would have her help me study. Like I'll give her my iPad with the lectures and like ask me questions based off of the slide. So that's something I did when I'm driving back home. I will listen to YouTube videos to get some studying in. So like being very creative with my time. Like I'm going to be in the car for over an hour already driving. I could be listening to music, sure, but I can also be listening to like information that I'm going to be tested on. So that's when I get home now. That's an hour I already dedicated to studying and like listening and absorbing information that I don't have to stay up late because I'm like, oh, I just spent like 2 hours, 3 hours driving back and forth. Yeah. Oh, you are? Ah, congratulations. I hope you have a safe delivery and that, that your baby is nice and healthy. But yeah, so those are some things that I have done and will like give advice on. Um this semester, I would say one thing I want to do differently is I'm not the biggest fan of studying in large groups. Like I know this and I remember like I did it only like once during the semester and then I told my friend, I was like, yeah, I can study with like max like 2, 3 people. And even 3 is pushing it. I would prefer to like study with like 2 people, 1 person. Like when it gets to be a lot, it's very overwhelming. So I rather like smaller groups. Like and I like to study by myself before I study with people, just because I have a good understanding of the information before going to study with other people, because I don't want to get confused. So if I'm studying with a group of people and you're telling me false information, I'm believing it, then I'm going to be confused when I go look at my notes. I'm like, wait. What's T here? What's the actual answers? What's the actual information I should know? So yeah, I like to like study by myself first before I study in groups. And I would recommend that people do that because like I said, sometimes people might not have the right information. And not to say like that's necessarily a bad thing, but like you don't want to confuse yourself. And I already said at the beginning is learning how you study. I study well by rereading, relooking at information. I like flowcharts. I like charts that compare and contrast, or like they show me the way something is happening, because it's a good visual to see like what's the same, what's different. So really understanding those type of things. But I'm good at memorizing things. I've learned that about myself. I thank God for that. But I'm good at memorizing things. So I like to just go through like my lectures like 3 times. I really try to go like 3 times through all the lectures that's going to be covered. And then I also like to do practice questions. That's the other thing I do to see. And I think practice questions are good because it tells you and it shows you what are the commonly asked topics. So we can take something like asthma, right? There's a lot for asthma, but what do they typically ask you about asthma? What are the medications that you use for an asthma attack versus that you use for like long-term treatment, right? That's something that they are probably going to ask you if they're asking about asthma. What are the hallmark symptoms of asthma? There's 3. You should know them. And typically the other thing I guess like for asthma that they like to ask is like how is it similar or different from like COPD? Those are like I would say are the big 3. There's still a lot else for asthma, right? What causes asthma? Asthma can be caused because you have allergies or from like inhaling pollutants and stuff, right? So like there, but that's not something that's really commonly asked about asthma. It's usually medication, comparison to COPD, what are the hallmark symptoms? That's really the big ones, I promise you. So that's why I like doing practice questions. Practice questions are going to show me what are the commonly asked thing about this particular topic. And then if I know what the commonly asked things and the answers are, when I see it on the test, I'm going to be able to answer it. Even if they ask me in a different way, the answer is probably still going to be very similar or the exact same. So those are like my 2 things when it comes to test taking. And then the other thing is using process of elimination when you're taking a test. If you know the answer does not sound right or is wrong, automatically just like trash it. Don't even like spend your time worrying about it. But yeah, Okay. I'm gonna just wrap this up because I have been on for a minute now. Is again, I am asking you guys, if you want to help support me, support my nursing journey, just continue like watching my videos, engaging with my videos as well, and watching the ads on my videos, because that is how I get paid through YouTube. Obviously, you guys can send me money if you want, but I'm not asking you guys to send me money. If you want to, by all means, I will accept it because every penny counts at this point. But I don't like asking people to just send me money. I don't know. That's just a bit cringe for me. But the best way of outside of that is watching my videos, watching the ads, because I am monetized on here. Okay, live baby mama says bye. But yeah, so if you want to see me become a nurse and help me pay my tuition, please just continue to watch my videos, watch the ads, and just say a prayer for your girl, right? Say a prayer that like I will get the money I need in order to pay my tuition at this point in time. But I appreciate you all. I appreciate it all for coming on, sticking out, engaging, and chatting with me as always. So yeah, Adeline, hi there. Unfortunately, I'm about to end this. I have like a couple things to do, and I have work in like less than 3 hours. So yeah, I love you all, and I'll see you guys in my next one. Bye, guys.